We are again in 2003 Form 6 external paper. MCQ number 11. True or false about penicillin? Now, benzyl penicillin is classified as a broad spectrum penicillin. That is false. Now we'll see what is broad spectrum means. Now bacteria are classified on shape. See, these are cocci. These are chain shape. Streptococcus is in chain shape. This is stable. This is actually Streptococcus pneumoniae. This is Streptococcus pneumoniae. This is another chain of bacteria, Streptococcus. So this is Bacillus. This is Vibrios. Vibrios means like it has a comma shape bacilli with flagella. This flagella for movement. It means this is Helicobacter pylori. This causes stomach ulcers. Helicobacter pylori. This is gram when you do a smear. Slide dega color kara gram stain can color gram negatives rosa part gram positives bacteria dam part loru nil part up here. May the color dam part of the nil part gram positive may rosa part gram negative. Methana themai gram positive mother part of the Methana gram negative pain xylem neutrophil logeva. May the chain set here the streptococcus arga may gram negative may gram positive. Many part of it. May otamai Methana the streptococcus may may microscope again pain idiot serum the all these are microscopic structures. So bacteria are now divided into two, gram negative and gram positive. Gram positives are blue color, dark blue, gram negatives are pink in color. What is the difference? Now when you take a cross section of bacterial cell wall and bacterial cell wall, the important part is this it has a peptidoglycan layer. In gram positive bacteria, this peptidoglycan layer is very large, and in gram negative bacteria, it is only a small thin layer. What happens is when you put a dye called in gram stain, you place a dye that is blue color dye. It is called crystal violet. This is actually gentian violet in pharmacy. In laboratory, it is crystal violet. This is the chemical giving this color. So in gram negative bacilli, this peptidoglycan layer is very thin. So when you put something like alcohol, it goes away. In gram positive bacteria, it is a thick layer and it will not go away when you apply alcohol. So you wash and then put some other stain, pink color stain, then you get pink color in gram negative because there is no dye inside. Here it is because it is already stained with this crystal violet. So it is in same dark blue color. So this is the difference. So gram positive and gram negative, what is the main difference? They are cell wall, bacterial cell wall structure. So other part is the same. This is normal cytoplasmic membrane. So this is the difference between gram negative and positive. So when we say gram broad spectrum, that antibiotic, broad spectrum antibiotics kill both gram positive and gram negative bacteria. So the first question is, benzyl penicillin is classified as a broad spectrum penicillin. It is false because benzyl penicillin will kill only gram positive bacteria, not gram negative bacteria. So it is false. Go to now question B. Amoxicillin is known to cause diarrhea in children. That is true. Side effects, diarrhea, stomach upset, headache, abnormal taste sense, skin rash, vaginal yeast infection when you take amoxicillin. It is a broad spectrum. That means it kills both gram negative and gram positive bacteria. Both types are killed by amoxicillin. Ampicillin also same. Phenoxymethyl penicillin is oral penicillin. It is recommended to be taken after meals. That is false. Now, phenoxymethyl penicillin is absorbed in acid medium. That means at least 2 hours before meals they have to take it. So empty stomach. Phenoxymethyl penicillin, when you dispense, you have to tell the patient to take it empty stomach and not to take any meal for at least for 1 to 2 hours. 2 hours is the ideal. D. Cephalexin belongs to the family of drugs called penicillin. Cephalexin are called cephalosporin group. Penicillin, one group, cephalosporin, one group. Cephalosporin and penicillin both have beta-lactam ring. Fluoxetine is stable against common staphylococcal beta-lactamase group. Now I have no time to explain everything, but one thing I can tell you, not like other penicillin group antibiotics. Now, beta-lactamase, it is beta-lactamase resistant. What is beta-lactamase? Who produce? Beta-lactamase is produced by bacteria. Penicillin is coming to attack them. So, beta-lactamase is produced by bacteria for their protection. Because penicillin is a natural compound. Penicillin is everywhere. Penicillin producing fungus are everywhere. When bacteria and fungus are in the same environment, fungus release this, especially penicillin producing fungi, release penicillin producing fungi, release penicillin to the environment. So bacteria in the environment started producing an enzyme to break down penicillin coming from the fungus. It is still there. When we treat also, same thing happens inside our body. Bacteria produce penicillinase, that is also called beta-lactamase. There are small subgroups, but commonly called beta-lactamase. So penicillinase. Now this benzyl penicillin is destroyed. All penicillins are destroyed except a few. One is fluoxetine. Fluoxetine is not destroyed by penicillin because fluoxetine has in the structure, the beta-lactam ring, and it has this here branches, and these are branches. This branch is coming up to here. So normally beta lactamase enzyme destroy the beta lactam ring in the penicillin molecule. So here in cloxacillin, the branch chain covers that part. It does not allow penicillinase to come closer to the ring. So it is covered. It is called steric hindrance. It's covered. So we say cloxacillin is a penicillinase resistant penicillinase resistant drug. This has the explanation. So other drugs are similar to cloxacillin, flucloxacillin, dicloxacillin, nafcillin, oxacillin, methicillin. All these are penicillinase resistant. Okay, question number 12. Cefuroxime acetyl is an oral cephalosporin. That is true. Cefuroxime acetyl is an ester. It is given as in ester form in oral preparation. But remember, in the intravenous or parenteral preparations, only cefuroxime, no acetyl part. When we take cefuroxime acetyl, the ester is broken down, hydrolyzed, and cefuroxime is released to the blood. So cefuroxime acetyl is oral preparation, and cefuroxime is released in the liver after acetyl part is going out, hydrolysis. Question B, cefotaxime is an injectable cephalosporin. True. Powder for injection. Coamoxiclav is known to cause jaundice. That is false. Penicillins. Coamoxiclav is amoxicillin and clavulanic acid. Amoxicillin. Clavulanic acid is a beta lactamase inhibitor. That is penicillinase enzyme blocked by clavulanic acid. So amoxicillin can work peacefully because clavulanic acid is with the penicillinase. So the proportion, what is the coamoxiclav, amoxicillin, clavulanic acid. Amoxicillin 500 milligram, clavulanic acid 125 milligram, altogether 625 milligram. Amoxicillin 250 milligram, clavulanic acid again 125 milligram equal 375 milligram. These are the two types of tablets available. Now, in your pharmacy, you have only this one, 375 milligram tablet of coamoxiclav. That is, say, augmentin. We have only 375. You don't have 625. Still, you can, if a patient brings a prescription for 625 milligram, you can issue 375 one tablet plus 250 milligram amoxicillin tablet. So it is the same. When you add 250 milligram amoxicillin to this, again it is 625. If the patient, they have to do it with consent of the patient. Chloramphenicol is used topically for management of eye infections. True. Nitrofurantoin works better in an alkaline pH. No, not the alkaline pH. It works in acid pH. Nitrofurantoin. So question number 13. Thank you.